Good morning, students. We continue the topic acid base balance, and today's topic is anion gap and its clinical importance. This topic is very important in clinical practice. This anion gap may be increase, decrease, or does not change in various conditions that we will see in the clinical importance. Before seeing what is anion gap, you should know that in the extracellular fluid, the sum of cations and sum of anions are equal, and this is essential to maintain the electrical neutrality. For example, if suppose there are 100 cations are present in the extracellular fluid, then 100 anions are present in the extracellular fluid. These cations are of different types. At the same time, anions are also of different types. We cannot able to measure all the cations and all the anions present in the extracellular fluid. Therefore, for practicality, we will measure only two cations, that is sodium and potassium. They constitute 95% of total cations. That means remaining 5% cations are all other cations. There are so many cations in the remaining 5%, but these two are main cations of the extracellular fluid, and we will measure these two cations during the anion gap. So now we will call this sodium and potassium as measured cations. Now, similar to anions, bicarbonate and chloride constitute 86% of total anions of the extracellular fluid, and in the remaining 14 there are so many anions like phosphates, nitrates and sulfates, etc. So during anion gap calculation, we will measure only two anions, bicarbonate ion and chloride ions. So we call them as a measured anion. So for anion gap calculation, we require 4 electrolytes, out of which 2 are cations, that is sodium potassium, and 2 are anions, that is bicarbonate and chlorides. Now from this slide you can easily found out that the sum of measured cations, that is sodium and potassium, is 95%, and sum of measured anions, that is bicarbonate and chloride, is 86%. That means measured cations are always more than measured anions. Now this gap is called as anion gap. Very easy, right? Hence there is always a difference between the measured cations and measured anions. The unmeasured anions constitute a anion gap, right? Now this is the formula given here for calculation of anion gap. We have to, as I have told you, we have to measure 4 electrolytes, sodium, potassium and bicarbonate and chloride. When you subtract the sum of bicarbonate and chloride ion from the sum of sodium and potassium, you will get anion gap. So in simple word, anion is nothing but difference between measured cation and anion. Actually there is no anion gap in the body, right? Because in the first sentence I have told you total number of cations are equal to total number of anions, right? But as we are not measuring all the cations and all the anions, and we are measuring only 4 electrolytes, therefore in calculation we will get anion gap. Now this is called as anion gap, but actually anion gap does not exist in the body. Now what is the normal value of this anion gap? It is 12 millimole per liter. That means in normal person there is a difference of 12 millimole per liter between the sum of measured cation and sum of measured anion. Now in various conditions this normal value of 12 may increases to above 12. So in that case we will call it as a high anion gap. In some diseases this value of 12 is decreases. In that condition we will call it as a decrease anion gap. And some diseases the anion gap remains 12. So here we call it as a normal anion gap. So three types of anion gap are there: high anion gap, low anion gap, and normal anion gap. So we will study one by one each of these. First, try to understood the concept. What is mean by high anion gap? It is a conceptual question. In the upper side, I have given the formula of anion gap, where I have written sodium plus potassium sum minus sum of bicarbonate and chloride. High anion gap means if sodium or potassium or both increases in the body, right, then the difference is more. Now, in which condition sodium or potassium increases? If a condition exists where the other unmeasured cations 5% that we have studied, if they get decreases, for example H plus ion decreases, calcium ion decreases, magnesium ion decreases in our body, in the extracellular fluid, then to compensate these positive charges of that cation, the sodium and potassium level increases, right? So sodium potassium increase gives rise to high anion gap, because there some will increase, and the other meaning of that is increase in sodium potassium means, in other words, the other cations decreases, because we have to maintain the electrical neutrality in the body. So to maintain that electrical neutrality, sodium potassium level increases. Now think of another situation. In that situation, what happens? Bicarbonate and chloride, sodium potassium remains normal, but bicarbonate and chloride anion get decrease. Then also we will get high anion gap, because we will measure only these 4 electrolytes. So when this bicarbonate or chloride will increase in the body, if other anion increases, for example sulfates, nitrates, phosphates increases in the body, so what will happen? In that case, to maintain the electrical neutrality, the body will excrete these bicarbonate and chloride ions from the body. Therefore, the value of sum of measured anion decreases and you will get a high anion gap. So this is a conceptual question. If you understood this, then you can easily remember the causes of high anion gap that we will study in the further lecture. Now coming to the low anion gap. Low anion gap is reverse of high anion gap. So you will get low anion gap means value less than 12 millimole per liter. When you will get if the sum of sodium potassium decreases, and in which condition they will decrease? If the sum of other cations increases, like H plus ion, calcium ion, magnesium ion, if they get increases, to maintain the electrical neutrality, body will excrete sodium and potassium. So sum of sodium potassium or sum of measured cation decreases, and whereas bicarbonate and chloride remains normal. So in that condition you will get low anion gap. And second situation, when bicarbonate or chloride ion increases, sodium potassium remains normal, but bicarbonate and chloride level increases, the gap is narrow or decrease. In which condition bicarbonate and chloride increases? When other anions like sulfates, phosphates, nitrates, they decrease. When these ion decreases, to maintain the electrical neutrality, body will retain the bicarbonate ion and chloride ion. So in this way you will get low anion gap. Again concept, decrease in sodium potassium, that is not important. What is important is why there is decrease in sodium potassium, because other cations have increased. That you have to remember. Or increase in bicarbonate and chloride. That is not important. What is important is you have to know that other anions have decreased. So this is about low anion gap. Normal anion gap. In this condition, what will happen? There is decrease in sodium or potassium or both, but their decrease is equal to the decrease in bicarbonate or chloride or both. Or you can, in other words, you can say there is decrease in measured cation and that decrease is equal to the decrease in measured anion. That means measured cations and measured anions decreases at same level. As the patient is deceased, the anion gap is normal, that is 12. Why it is not 12? Because both cation, measured cation and both measured anion decreases. So in this case you will get normal anion gap. Normal anion gap does not suggest the electrolyte balance of the body is normal. What normal anion gap says that? Normal anion gap says that decrease in sodium potassium is equal to decrease in bicarbonate and chloride, or decrease in the measured cation is equal to the decrease in the measured anion. That does not mean that electrolyte balance in the body is normal, right? Now coming to the condition, disease causing high anion gap. I have already told you what is a high anion gap. So first disease is diabetic ketoacidosis. In diabetic ketoacidosis, there is increased production of ketone bodies. So what will happen if ketone body increases? Ketone bodies are acidic in nature, like beta hydroxybutyric acid, acetoacetic acid. They are acidic in nature. So if the ketone bodies increases, what will happen? H plus ion increases because they are acidic. They give H plus ions. Ketone bodies are acidic in nature, so they give H plus ion. H plus level in the body increases. If H plus ion in the body increases, the pH tend to fall. But I have explained you in the last lecture, if pH falls below 7.35, it have deleterious effect on our body. Therefore, the bicarbonates present in the extracellular fluid, they combines with H plus ions and neutralize that H plus ions. So what will happen here? The concentration of bicarbonate ion decreases. In the above formula C, that means the concentration of measured anion decreases. When the concentration of measured anion decreases from the above formula, you can say that you will get high anion gap. Same case with lactic acidosis. Again, lactic acid level increases. Lactic acid generally increases commonly in hypoxic conditions or during severe exercise. Lactic acid production increases. The reason is same. Lactic acid increases, it gives H plus ions. To neutralize these H plus ions, bicarbonate ions are utilized. Next cause is renal failure. In renal failure, the main effect is decrease ammonium ion formation, and there is decrease in sodium hydrogen exchange which occurs in PCT, that we have studied in our previous lecture. See here what is happening here. H plus ions are excreted in exchange with sodium ion. In renal failure, this mechanism is disturbed. So if this mechanism is disturbed, what will happen? The H plus ions are not excreted from the body. So what will happen due to that? These H plus ions are retained in the body. When these H plus ions are retained in the body, to neutralize these H plus ions, the bicarbonate ions are utilized, and due to utilization of bicarbonate ions, measured cation level decreases and you will get high anion gap. So in renal failure, that sodium hydrogen exchange does not takes place properly, or the rate of exchange get decreased, due to which H plus ions are retained, and to neutralize the H plus ion, bicarbonates are utilized. Amino aciduria. Now this is a metabolic defect due to deficiency of various enzymes in amino acid metabolism. Therefore, the amino acids are not converted into their end product. If you study the protein metabolism, then you will find that various amino acids are converted into their end product and then they get excreted. If during that pathway, if any of the enzyme is deficient, then that amino acid is not converted into its end product, therefore it is not excreted. So these amino acids will form various acids in that path, intermediate, and these acids again causes same deficiency of bicarbonate ions. Next is organic aciduria. In organic aciduria, the concentration of methyl malonic acid and propionic acid are increased, and this excretion of methyl malonic acid in the urine is called as organic aciduria. So here, when this methyl malonic acid is formed in our body, when the propionic acid is converted into succinyl CoA, try and find out this pathway. When there is beta oxidation of odd chain fatty acid, propionic acid is formed, and that propionic acid is converted into succinyl CoA, and then succinyl CoA enters into the TCA cycle. The intermediate of between propionic acid and succinyl CoA is D-methyl malonic acid and L-methyl malonic acid. If this pathway is blocked, then this methyl malonic acid is not converted into succinyl CoA and its level in the body increases. As it is an acid, it leads to production of H plus ions. To neutralize the H plus ion, bicarbonates are utilized. Next cause is methanol poisoning. If a patient consumes methanol, after the metabolism of methanol, it gets converted into formaldehyde and then it is converted into formic acid. This formic acid is a very strong acid as compared to ethanoic acid and propionic acid and other acids. So it will produces more H plus ion, and again to neutralize the H plus ions, bicarbonates are utilized. And high anion gap is also seen after intake of some drugs, because the end product of these drugs are acidic in nature. So these are some causes of anion gap, high anion gap. Now coming to the causes of low anion gap. What is low anion gap? I have already explained you. So in low anion gap, the causes are hypoalbuminemia, means decrease in the albumin, plasma albumin. Why it causes low anion gap? Because normally albumin have negative charge at pH 7.4. So if there is hypoalbuminemia, that means albumin level decreases, that means negative charge in the extracellular fluid decreases. To maintain the electrical neutrality, either bicarbonate or chloride ion increases. Generally chloride ion in the body, in the extracellular fluid increases. So there is gap between measured cation and measured anion decreases. Now multiple myeloma. Multiple myeloma, it is a plasma cell tumor where plasma cells synthesize an abnormal protein called as paraproteins. Now these proteins have positive charges on them. So in multiple myeloma, there is increased production of paraproteins which have positive charges. That means in the extracellular fluid, positive charges increases. To maintain the electrical neutrality, body will decreases the concentration of sodium and potassium through their excretion. So what will happen here? The measured cation decreases and the gap becomes narrow. Hypercalcemia. Again, all of us know calcium is positive charge ion. If the calcium level in the blood increases, that means positive charges in the extracellular fluid increases. To maintain the electrical neutrality, sodium and potassium level are excreted by the body. So measured cations decreases, again narrowing the gap between measured cation and measured anion. So these are few important causes of low anion gap. Now next is disease with normal anion gap. First case is diarrhea. In case of diarrhea, there is loss of intestinal fluid. This intestinal fluid is rich in bicarbonate ion as well as sodium and potassium ions. So equal amount of bicarbonate and sodium plus potassium are lost. Therefore, measured cation and measured anion, their value decreases, but the anion gap remains normal because their decrease is equal. Next cause is renal tubular acidosis. In this case, as the name suggests, renal tubular acidosis. Here, kidney will not able to excrete the H plus ions, and it will also fails to reabsorb the bicarbonate ions. Right? First happens kidney. Generally, we have seen the mechanism where kidney will excrete the H plus ion in exchange of sodium ion. Here, the kidney will fail to excrete the H plus ion, means that H plus ion will retain in the body. Therefore, it is called as acidosis. At the same time, if you remember, in the last lecture I have told you, kidney also reabsorbs the bicarbonate ions which are filtered through the glomerulus to maintain the alkali reserve of the body. So that mechanism also fails. So what happening here in this situation? On one side, H plus ions are retained, and on other side, bicarbonates are lost. Why bicarbonates are important for us? To neutralize the H plus ion. Bicarbonates are very important. So this happens in renal tubular acidosis. Now when these bicarbonate ions are lost, that means negative charges are lost. To maintain the electrical neutrality, chloride ion increases in the body. You have to maintain the electrical neutrality, because when there is loss of bicarbonate through the urine because of non-absorption of bicarbonate ion by the kidney, negative charge is lost. To maintain the electrical neutrality, chloride ions are retained in the body. So therefore it is also called as hyperchloremic acidosis. Right? Hyperchloremic acidosis. So if you see the anion gap formula, what happens here? Bicarbonate ion decreases and chloride ion increases. Therefore, the sum of bicarbonate and chloride remains same. But as H plus ions are retained in the body, it is acidosis, and chloride ion increases in the body, therefore it is called as hyperchloremic acidosis. Next cause is ureteric transplantation into the large gut. Normally all of us know ureters open into the urinary bladder. But if there is a bladder cancer, then at that time we have to remove the bladder of that patient. So where these ureters will open, then surgeon will transplant this ureter to the large intestine, or the ureter will open into the large intestine and urine will collect in the large intestine. Right? So during that process, what will happen? When these ureters are transplanted into the large intestine, then chloride ions are reabsorbed and bicarbonates are lost. Again, there is hyperchloremic acidosis. And the last cause is acetozolamide therapy. In the last lecture also I have told you, this acetozolamide drug inhibits the enzyme carbonic anhydrase. When this carbonic anhydrase is inhibited, this mechanism of kidney hampers. So which is this mechanism? In this mechanism, if you see, kidney is excreting the H plus ion into the lumen, and from the lumen they excrete it through the urine outside. At the same time, bicarbonate ion is regenerated and which is entering into the plasma, means in the body. So in this mechanism, kidney is losing one H plus ion and gaining one bicarbonate ions. For this purpose, this enzyme carbonic anhydrase is important enzyme. The acetozolamide therapy means acetozolamide drug. Therapy means drug. It inhibits this enzyme carbonic anhydrase. Therefore, generation of bicarbonate ions is affected. At the same time, secretion of H plus ions are also affected. So again there is decrease in bicarbonate ion. To maintain the electrical neutrality, chloride ions are retained in the body. So here these are the causes of normal anion gap. So this is the concept of anion gap and its clinical importance. Thank you very much.